My name is Dr. Marc Ruel. I'm a cardiac surgeon here at the University of Ottawa Heart Institute. I'm also the principal investigator of the MIST trial, which stands for minimal invasive versus sternotomy. The trial pertains to bypass surgery, which is the most common major operation of human beings, and we found a new way to do it. Typically, heart surgery is performed by going through the breastbone, making an incision in the middle of the front. However, although this is a safe incision, sometimes it doesn't heal. We found this way of going between the ribs through a 5 centimeter incision and doing 2, 3, 4, 5 bypasses. What the paper is about is that we compared it in a random setting, a randomized trial of comparing the classic approach versus the new approach, and found that there's better recovery. In my view, the MIST trial is unique in 3 ways. First, it is the first randomized trial that has compared minimal invasive bypass surgery to conventional bypass surgery. So before that, we didn't have any evidence really proving that the recovery could be faster. Second, and perhaps most importantly, it represents a new option for patients. Patients now know that if they need multiple bypass surgery, they may choose a conventional approach, which is still a great approach, but they now have the option of having a less invasive approach, which is growing around the world. And I would say thirdly, related to that, this is really going to have a lot of impact globally. It's a Canadian innovation, it's a Canadian-led trial, but our trial is going to have impact all around the world, in my opinion. It's already the fastest growing form of heart surgery, minimal invasive bypass surgery. I think the MIST trial will really provide the evidence that's needed to really give it support towards growing the expertise towards being able to offer this to patients in centers all around the world. I think the most important message of the MIST trial is that if you need multivessel bypass surgery, there's now another way.